All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Good evening, dear friends. This is JASSEELA MUJEEB welcoming you to a brand new episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. In each episode of this talk show, we bring before you an expert doctor from Al Hilal Hospital to discuss your various health issues. Today we will be discussing about aligners. Aligners are orthodontic devices used to correct the teeth alignment. And the doctor joining us today is Dr. RAJEESH from Al Hilal Hospital, and he is a specialist orthodontist with an experience of more than 22 years. So doctor, welcome to the show.
Thank you. Good evening. Thank you for this opportunity.
It's a pleasure, doctor.
Yeah.
So today we are discussing about aligners. Yeah. So doctor, what are aligners and what is the difference between aligners and braces?
See, aligners is a new treatment option which is available for patients. Just like how we use braces, metal braces or aesthetic braces, we have aligners which are a removable kind of braces which helps in aligning the teeth. It can be used for adults as well as children, and it's a much better, faster treatment option which you can use for correcting your teeth alignment or crowding of the tooth. Many different malocclusions can be corrected with aligners just like braces.
So in what all treatments are aligners used? Can you explain it?
See, aligners can be used for if you have crowding of the teeth. That is, there is no space between the teeth and you need to align your teeth. You can use aligners for that. If you have protrusion, that is, your teeth is placed forward and you need to correct it and bring it back, we can still use aligners. So it all depends from patient to patient reason for having the braces. So we have to see individual patients, see what their requirement is, what their expectations are, and depending on that, we do the treatment.
Okay, doctor. Now, what are the advantages of aligners over the braces?
That's a very good question. Now, see, braces have been there for a long time, and most of the people or patients understand only braces. Now, when you have braces, you have brackets on each teeth, and then you have a wire which runs around the bracket on the tooth, and that applies the force, and the tooth moves. Depending on the force being applied on the bracket, the tooth moves according to that. So it's on a monthly basis which you do the checkup, and the braces treatment goes on a monthly basis. Now, with aligners, it's not fixed to your teeth. It's a removable kind of braces, so you can remove it. Like when you have food, you can remove it. When you have like when you have to brush your teeth, you can remove it. Now with braces, that option is not there. So the advantage is you can remove it, and second advantage is you don't have any restrictions on food. You get free to have whatever you want. Now with braces, what happens is when you have something hard, there are chances that the braces might come out, or sometimes the wires becomes loose and comes to one end. It hits your cheek and causes pain. And there are issues like that which usually happens with braces. With aligners, that issue is not there. So it is much more convenient way of doing it. The third advantage is it's discreet. Nobody will know that you're doing the treatment. Like braces, which is visible, aligners are like invisible. You can say it's invisible kind of braces, which helps to do the corrections with being discreet. So nobody is going to know that you are doing the treatment. So that is the advantage of aligners over braces.
And now you mentioned about the advantages. So doctor, can you explain the treatment in detail for us? How the treatment goes?
Okay. So now when you come, initially we actually see your problem. We are trying to understand what your problem is, what corrections you require. Then we take x-rays. So we take two x-rays. One is called as a lateral ceph, one is called an OPG. So one shows us the full view of your teeth, and other one shows only a profile of your head and the tooth, and to see how your teeth is related to the bones. After that, what we do is we do a scan for your upper and lower teeth. The scan, it's an intraoral scanner which we scan your teeth. It's just like taking photographs of your teeth. So, but it shows in a much bigger 3D version of how your teeth is. Now, with this scan, the advantage is that we will be able to make the patient understand what the problem is. One. Second thing is we can show a before and after treatment simulation, which will show it's not the exact treatment result, but it will show approximate treatment result, which the patient will be able to understand the changes that will happen when they do the treatment. So we'll be able to show a before and after even before you start the treatment. So that is the advantage of when you do a scanning of your intraoral teeth, and then show it to the patient so they understand what is exactly happening. So you get an idea of what happens when you do the treatment. So once that is done, then we collect all the records, photos, and then we send it to the aligner company which we are using, and they send us a treatment plan. And that treatment plan is shown to the patient, and we see if there are any changes to be made, or if the patient is happy with the treatment plan what is received, and if they're happy with it, we approve the treatment, and then we start the treatment for the patient. So getting the aligners from the aligner company may vary from say 2 weeks to 4 weeks. So it depends on which company you're using. So yeah, this is the usual process what we do when we do the aligners.
And doctor, how long will the treatment process take? The braces take 1.5 to 2 years almost. So how long will this
I wouldn't say aligners are much faster than braces, but it does have certain advantages in treating some malocclusions, which will help to correct the malocclusions faster. But I would say it would take the approximate time, maybe plus or minus 2 months or 3 months. But the difference is the convenience and the advantage of removing the aligners. So that makes it even more convenient for the patient to continue with their normal routine. They don't have to disrupt their routine, and no changes in their diet as well. So yeah, that's how it's done.
And doctor, what about the follow-up sessions?
Follow-up sessions, if we see the patient is in the place where they're starting the treatment, we can see them every 4 weeks or 5 weeks. Now, if the patient is traveling, so what happens is we send all the aligners with the patient and we give them the certain amount of date which they have to change, and they have to change each aligners depending on that. Now, we will ask if the patient is taking all the aligners, how do you know the treatment is being done? Now, we have an app which helps to track the tooth. So each aligners, when they change, they take the photographs, intraoral photographs of the teeth before they change the aligners, and which we will be able to see from here how the teeth is moving. Is it doing as per the movements what we have planned, and we can advise the patient how to do it. So if it has not reached the stage where the teeth has not moved or the patient has not worn the aligners, we can tell the patient to continue the treatment, same aligners for say 1 week or 10 days, and then change it. So depending on that, the treatment progresses. So it's you can say we can see the treatment even when the patient is not there with us. So it's a much better, comfortable way of doing the treatment for the patient as well as for us.
The most modern treatment.
The most modern treatment, that's right. But if the patient is in the place where they are starting the treatment, we usually call them every 4 or 5 weeks, see how it is, do a scan and find out if the teeth is moving as per planned. So that helps to track the movement, and we know that the treatment is on track with what we have planned for.
And are there any precautions to be taken once we wear this aligners?
Aligners, I would say the disadvantage of aligners is that it's removable. So unlike braces, if you wear the braces are always fixed to your teeth and you don't have to worry about it. But whereas aligners are not fixed to your teeth, it's removable kind of braces. Now, if you have the aligners, you remove it and keep it out for a longer time, and then you forget or you don't wear them according to the instructions what you receive from the orthodontist, then what happens is the treatment will not progress. So when you go to the next aligner, it will not fit properly, it will be painful, all that issues will be there. So the main disadvantage is it's removable. So if you are not following the instructions, I would say don't do aligners.
This is a disadvantage of aligners.
That is the main disadvantage. But when you consider with rest of the things, that is, if the patient is very motivated to do the treatment, I don't see this shouldn't be an issue. Because we have children who are 6-7 years old who are doing the treatment and they follow it. They follow the instructions what we give them, and they get beautiful results.
Okay.
Yeah.
So these are just like braces.
Just like braces, yes.
Okay. Doctor, now what is your advice to our viewers?
Advice, see, orthodontic treatment can be planned at an early age. So, see, we have 2 sets of tooth which when we have children, we have what we call as a milk dentition. Or the primary dentition, where you have milk teeth. The milk teeth falls off from the age of 6 to 12. So in between that time, mostly we had this notion that we can do it only after the age of 12. But certain kind of malocclusions we can intervene before and try to reduce the severity of the problem that they have, so that you don't have to go into an extent where you have to remove teeth. So we can do the corrections beforehand. But of course, yes, the treatment will be a longer stage or a longer phase of treatment, which will have to be divided into 2 stages. But you will be able to view the problems what are developing. So at the age of 6 to 8, if we can bring them in and show the children how their teeth are getting developed and what are the issues that they can face in future, we can plan the treatment according to that and reduce the severity of the issues that when they are at the age of 12 or 13. So my sincere advice is bring your children, show them at an early age to see if there are any issues that in future they might have to treat.
We are of the assumption that very small children should not be treated with braces and aligners. But now, as you told, as early as possible is better.
See, medical science is always evolving. It's always changing. You have new things coming up every day, and whatever notions was there before, it's changing. It's changing, and they're trying. We are getting better methods of treating different malocclusions or different problems what patients have at an early stage, so that we have new inventions which can help us in deciding all this. So yes, it's a field which is progressing every day.
And finally, doctor, what do you have to say about Al Hilal Healthcare?
See, we are one of the fastest growing medical centers in the kingdom, and we are trying to make sure that all our treatments are achievable and affordable to most of them. So that is what we are trying to do, and we hope to excel in it as well.
Thank you, doctor. Thank you for joining us today and giving us a lot of valuable information about teeth aligners. Thank you once again.
Thank you so much for the opportunity provided, and I hope we can do more in future. Thank you so much.
It's a pleasure. So viewers, as doctor said, aligners are the aesthetic device to improve our smile. Keep smiling, be happy, be healthy. Until we meet again next time, this is JASSEELA MUJEEB signing off. Good night.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.